So we currently have 4 types of exposure therapy. The first is in vivo or situational exposure. Next we have imaginal exposure. Then there's interoceptive and virtual reality. In vivo exposure, we're directly facing what a person fears. So in flight phobia, it may be to actually take a flight or various steps that involve an actual flight or a plane. For social anxiety, it may involve a social situation that is feared, or in OCD, touching an item that feels contaminated. What's so important, though, is to make sure that what we're facing matches the person's fear. This is where every exercise can be just a little bit different based on the person. Imaginal exposure involves accessing a person's fears through imaginal or cognitive means. So the types of thoughts or fears that a person might have could involve failure, making a wrong decision, thoughts of harming someone, impulses to do things that are inappropriate, thoughts of death, or choosing the wrong relationship. These are all things that typically in vivo or situational exposure wouldn't work with, because we're not going to actually have a person do those things. So to face them, we access them through imaginal or imaginative means. There's a lot of different ways to do this. One of the most common is scripts. So a person may write out the fear and thoughts that they have around that, maybe in story form, maybe it's a short phrase or a word, to access what they fear. So besides stories, a person may actually do recordings. Phones are a great way to record a thought, a phrase, a story to listen to, which actually triggers a person in that fear. Videos, for example, YouTube is a great place to find a countless array of different videos that could be triggering depending on what a person's fear is. And then last of all, maybe visualization, where a person actually visualizes in their own mind the situation that they fear. And all of this is part of that systematic confrontation of the fear and reducing the fearful response. And in so doing, we incorporate new learning that a person can face the situation, which boosts their confidence and over time decreases the distress. Now, imaginal exposure is probably the most confusing to understand. It's hard to wrap the mind around initially. And one of the initial criticisms that comes up, or concerns, would be the question, well, aren't I creating more problems for myself? Aren't I creating negative thoughts or adding more of a burden to myself by doing this? And really, it's actually just about facing what a person is already experiencing or already having thoughts or intrusive thoughts about. Imaginal exposure is realistically facing what a person is trying to avoid. Interoceptive exposure involves deliberately bringing up physical sensations that are feared. So this is maybe most common in panic disorder, but applies with other situations as well. So for example, if a person becomes fearful when their heart is racing, or if they feel shortness of breath, sweaty palms, interoceptive exposure allows a person to access that sensation and to have a different experience with it, so it doesn't automatically trigger what they normally experience and the responses that they experience too. So most commonly, I probably use the straw most often to create a sense of shortness of breath. This cocktail straw, even still to this day, really creates that in me. So breathing in and out through it, sometimes for a minute, a couple of minutes. That shortness of breath can feel that very strong. This is what we're trying to access. So another example might be putting one's head between their legs and lifting up rapidly. Whew, I actually feel dizzy doing that. The dizziness, that's something that we may access if a person has a fear surrounding that as well. All of these are ways to face the feared situation, sensation, and then to break apart the fearful response. Virtual reality exposure, which is a fairly new technology in the grand scheme of things, gives us one more way to access feared situations. So in virtual reality exposure, though a lot of folks may say it's just imaginal exposure, it might be more of a cross between in vivo or situational and imaginal exposure. It gives us access to the experience in certain circumstances that otherwise might be very difficult to access. One of the most common would be in-flight phobia, where a person, for financial reasons or access reasons, might find it very difficult to do practices on an active plane, especially a plane that is being flown at the time. Virtual reality exposure, here I come. I'm Justin K. Hughes, licensed professional counselor. Follow me on any social media platform or go to my website and/or blog at justinkhughes.com for much information and many free resources.